Hi, good afternoon, and thank you for the council members for taking time to address our issues. Good afternoon, my name is Wanda Hernandez, and I was diagnosed with HIV/AIDS in 1995. I became a HASA client in 2001. I serve as the chair on the board of directors for Vocal New York. We are submitting testimony for the record, but I'm not going to focus on new substance abuse. I'm going to focus on just the new substance abuse policy. Vocal supports a voluntary and evidence-based referral system for HASA clients who have problem drug and alcohol use. But that's not what the Commissioner Dodd announced last November. He announced a Get Tough policy that will mean more people are placed in costly and unhealthy shelters where they are less likely to take their meds, go to the doctor, or practice harm reduction. Let's be real. This policy isn't about helping people reduce the harm that drugs can cause in their lives. It's a bait and switch to divert attention away from what really drives the arrears in HASA, the unsustainable severe rent share burden that clients may be forced to pay. Let me tell you a little bit about my story and how I fall into arrears every single year. I know to have learned of this policy is new to me. I didn't fall into arrears because I have a drug problem. I have an affordable housing problem and I have a poverty problem. I pay over 70% of my hard-earned Social Security disability income towards rent each month. I ended up in arrears because Con Ed, I can't afford to pay for it, so my bills piled up after I pay my rent each month. I can't afford to buy food. The food stamps run out in the middle of the month, and because of the budget cuts, I no longer qualify for my own pantry or Ensure nutritional drinks. I can't afford to buy clothes, so I live on hand-me-downs. I can't afford a Metro card, so I have to reschedule appointments like going to the doctor, and that includes every single time I visit HASA, I don't qualify for a Metro card. Toiletries are over-the-counter medicines, they add up before you know it. Something is always breaking down or needs to be replaced, like my blender, my computer, which is a lifeline for me, or a bedspread, which needs to cover my bed. I can't even think about luxury like going to the movies. Trying to stay afloat takes a toll on my mental health. Sorry, I'm just a little bit upset as everybody else is. It increases my stress and it leads to my anxiety attacks, which finally kicks in my chronic pain. It was humiliating and it was frustrating enough to ask for help from HASA last November when I owed a $700 Con Ed bill. To be clear, one-shot programs for arrears give with one hand and they take away with the other. Any assistance you receive is recouped in the future, trapping you into a cycle of debt. Then HASA told me that I had to go to this drug screening appointment before I could get a one-shot deal. I felt degraded and I felt like they violated my privacy. If I hadn't answered the questions appropriately, HASA could have denied me the assistance I needed to stay in my apartment and prevent my utilities from being shut off. We can't let HASA change the subject when it comes to what's driving arrears among our clients, especially those with our specific needs. The simple solution is a 30% rent cap, which the City Council has already consistently supported, which we thank you for. Not a witch hunt against suspected drug users. Thank you.